drug industry has been disastrous. They're leaving left and right. They supply our drugs, but they don't make them here to a large extent. And the other thing we have to do is create new bidding procedures for the drug industry because they're getting away with murder.
Well, that was President Trump blasting drug companies over high prices. And today, the president is set to address lowering the cost of prescription drugs. Joining us now is Health and Human Services Secretary Alex Azar. Secretary Azar, the drug companies, of course, always say, listen, it costs a lot of money, $1 to $3 billion, up to a decade to get a drug from concept to proof, the different phases, the applications. And then once they've gone through all of that, they expire. Their ability to hold on to them and make money from them is a short-lived experience. What do you say to that?
Hey, Charles, first, great to see you again. And, you know, this is the president's agenda to put American patients first, but it's doing so with a balance. He's going to bring affordable prescription medicines to people, but still using private sector, competitive vehicles that respect the need for innovation. And America will remain the innovative pharmaceutical center of the world, but our patients are going to get more affordable drugs and our taxpayers are going to get better deals under the president's initiative.
I know you don't want to get too far in front of the president unveiling this, but can you give us some glimpse into steps that will be taken to accomplish this? And to your point, keep the private sector drug companies competitive enough that they're still delivering life-saving cures and medicines.
You bet. So the plan the president's going to be rolling out this afternoon will be the most comprehensive plan for prescription drug affordability by any president in American history. It's going to have 4 key elements: increasing competition, more branded, generic, biosimilar competition to get cheap, competitive, affordable drugs out there for people. Second, improving the negotiations in our government programs, so unleashing those who negotiate for us with the greater powers of the private sector to negotiate good deals for us, and also in parts of our program where there's no negotiation, where right now we just write a check, instead harnessing the private sector to do better negotiations for us. Third, creating incentives for these drug companies to stop jacking up the list prices so much, make the math work so that there's a financial disincentive on these list price increases that hurt patients so much. And fourth, get at the out-of-pocket costs of our people when they walk into the pharmacy or when they go into the hospital, reducing those out-of-pocket costs for folks. So it's going to have those 4 key elements, over 50 different initiatives, very sophisticated, the kind of thing you'd expect from a CEO like Donald Trump, getting at the real heart of the business problem here. Right.
And, you know, of course, Americans know all the horror stories of a lot of times orphan drugs being taken and then the prices being jacked up to the moon. Mylan Labs, in fact, came under a lot of heat for doing something like that. So how do we find a way to say, if you've got the orphan drugs and you've got something laying around for a wild actor to go in there, or even an established company with a poor pipeline like a Mylan, to abuse the system and, again, you know, keep this competitiveness that we cherish so much?
Yeah, so that gets to the second element of the president's plan, which is enhancing our powers to negotiate. And so we're going to make sure that those who negotiate on our behalf have the power to deal with those kind of situations where you have, say, a sole source generic and they attempt to exploit the power that they have from that. And we're going to give the plans that negotiate for us greater power to deal with those kind of situations.
Sir, 2 more things I'd like to get from you. The role of pharmacy benefits managers, and also there's scuttlebutt out there of making people outside of America pay more for these drugs because obviously we know a lot of people just ordering them online, and it's really curious to Americans why these life-saving drugs would be so much cheaper outside of this country in the first place.
So first, on your question about pharmacy benefit managers, we do think that this is a worthy topic of discussion, this question of how we use rebates in our system. The drug companies have really high list prices, and then they negotiate these rebates to get them down lower. But all that does is have these huge incentives to list prices there. So that'll be part of what we discussed today, is these weird incentives that we have in our system to high list prices. Now, on this issue of foreign free riding on American innovation, the president's got a 2-part plan. The first is we need to pay less. we're paying too much for our drugs. So that's where so many of the initiatives the president's rolling out go at that.
Right.
But then in our trade agreements, we need to negotiate with our partners. They need to pay more because they're using socialist price controls, market access controls to get unfair pricing in their systems, and they're doing it on the backs of their patients. God help you, if you get cancer in some of these countries, you don't have access to those therapies. You know what you do? You fly to America to get your cancer treated.
If you can, that's for sure. Secretary Azar, thank you very much. Always appreciate it.
Thank you, Charles.